So, take two. So, Sierra, could you just share how your whole journey started with the concussion and the seizures?
So my junior year, I was playing basketball, running down the court, and got tripped and fell and hit my head face first. Then two girls landed on top of me. And then after that, I had to go through vision therapy due to the double vision and not really remembering anything. And then that took a while. I was out the rest of the season. And then right before senior season started, I got released to play again. So then I started playing and had a seizure during a basketball game.
So, and that was 13 months after the concussion, and is when you started working out heavy, and it was actually during a basketball game when you had that first seizure?
Yeah.
What was that like?
All I remember was just not feeling good, and I asked to come out, and then I said I was gonna pass out, and that's all I could remember.
And I know your mom was scared to death.
Yeah.
And so from that first seizure, stopped basketball right away. And you'd gone to how many specialists? Three different specialists. You had several MRIs, right?
EEGs, everything.
Yeah. And who were the specialists that you saw?
In Tri-Cities.
Yeah, but there was a neurologist and a neurophysiologist, and didn't you go to OHSU? No. Who's the third one? I'm trying to remember.
Just the one through the telemedicine when I was in the hospital.
Okay. And they tried you on some different anti-seizure medications, and
I kept having them.
Yeah. And how frequent was it?
Almost every week or every month or every day.
And they would last anywhere from 20, like 2 or 3 minutes to
an hour.
And these aren't just like mild seizures. You were like convulsing and so then you had the concussion. You also had several like things you had to take antibiotics for over that year, which is common with concussions. You have leaky blood-brain barrier, then you develop a leaky gut, and so. But then I saw you, what was it, like 18 months after the concussion?
Mm-hmm. Yeah.
And you, why don't you just tell, for the viewing audience, a little bit about the treatment that you had before you came here and what we did and how it was different and how you responded.
Before I came here, I was just getting like medicine poured at me from every doctor, like seizure medicine, and I just felt worse. And I would constantly still have them. They wouldn't really listen to how I felt. So then when I came here, like you would listen and explain what you were doing and like why you were doing it. And then I felt like way better right away.
And what do you think it was that we did that made the difference?
Diet, watching like what I do and my supplements and
working on your skull and
my skull
and your neck,
jaw. Everything.
So we worked on you neurologically, structurally, because you had all kinds of stuff, scar tissue that had developed from after the kind of the whiplash from and your cranial bones were misaligned. And so after that first, 3-4 treatments, you went how long without a seizure?
3 months.
So when we started treatment, you went 3 full months without having a seizure. And then, and I was working on your gut, healing your gut, working on getting your skull bones to move, and we were doing laser and eye lights and all kinds of things, weren't we? Then we had a little setback. I didn't see you for how?
A month.
I didn't see you for a month, and then what happened over Christmas break?
I was having seizures like every day.
You had like 4 or 5 of them over Christmas break, 2019. Yeah. And why do you think the setback?
I'm probably not coming and still getting the adjustment in the skull and jaw.
Work. You think the work on the skull and the jaw and the laser is just kind of everything we did all combined that you feel like made the difference?
Mm-hmm.
So anybody out there who would be in your position, has had a concussion, having difficulty recovering, what would you say to them?
Not give up, even though it's really hard and frustrating. Like, I still struggle with it because I know, like, it's my life now. Like, I have to change. Like, I didn't have seizures before, and now I do. So, like, I just don't want them to give up and, like, go ask for more options, like, no matter what the doctor is or anything.
And so maybe seek out someone who does functional medicine, chiropractic, functional neurology type stuff. Yeah. I think I jumped ahead of myself. After you had like 5 seizures, so we had 3 months without any seizures right after we began treatment, working on your gut and everything. And then we didn't see you for a month. You had 5 seizures over spring or Christmas break. And then you started coming back again in January, right? And we did a treatment, and then you had 1 more seizure after that. But now you've been, almost another
3 months.
3 months, because we've been seeing you about every 2 weeks. Twice we'll see you, because you're driving all the way over from Tri-Cities. So anything else you want to say, or no?
No.
Thank you for doing this. I appreciate it. All right.